was 16 years old, I was told that I had 6 months to live. And it was extremely shocking for my family because, I was just kind of your typical kid. I was 16 years old. I was on the yearbook. I played volleyball. I sat bench for volleyball, but I went out. I had a uniform. I had a lot of friends. We used to go to the Jersey Shore for the summer and go play out, at the beach and stuff like that. So it was just kind of a typical, life, and didn't seem like there was anything ever wrong with me. So the first clue that something was actually wrong was one weekend I had gone to the Jersey Shore with my friends, and we had been out all day playing beach volleyball. And actually, if I'm on a team of people who don't know what they're doing, I'm pretty badass. I can dive into the sand and spike and do all this stuff. And so, we've been really active. And that night we were up all night talking and hanging out. And the next afternoon when we actually woke up, I remember I had the most excruciating pain I'd ever felt in my right shoulder. It was not like a normal pain. It felt like something was broken. It hurt so bad. And all I could think about was it must have been the spiking, or, I did something. But I didn't want to be a downer to anyone. I didn't say anything. But I remember we went to a diner and I had these pancakes, and I could not get the pancakes in my mouth. It hurt so bad. And it was just, I was thinking, okay, when I get home, I got to tell Mom because I think I need to go to the hospital. This hurts really bad. And I was leaving the next morning anyway, and I said, okay, this is pretty bad. Maybe I need some medicine or something. And so I got through that day somehow and went to sleep that night. And the next morning I woke up, and this excruciating pain that felt like it would take weeks to heal was gone, just gone. Right shoulder was completely normal. But the strange thing was that same exact identical pain was in my left shoulder. And not being, at that point, a doctor or scientist, I had no idea what that could mean or if that was even possible. I remember sitting there going, okay, pancakes I eat with my right hand. It was the right arm, but it moved. And so I don't know what I was thinking, but it was so unusual and it was so strange that I just didn't say anything because I just didn't think anyone would take it seriously. It sounded like a hypochondriac thing or just crazy. And after a couple of days, it disappeared from that arm too. And I just kind of forgot about it for a little bit. And as the summer went on, little strange things like that started happening. At one point, my knee started really, really hurting badly. That pain showed up again in my knee. And there was some swelling that came with it. So I went, something identifiable. And I showed my mom, look, my knee is swollen. And she went, okay, let's make an appointment with the doctor, which meant I had like 4 weeks before I was going to see somebody. And not long after that, migraines started. And these were so bad that I would literally be vomiting for days from the pain. And when they first started, my mom was just reminding me of this story. I was talking to her when I was writing my book and I was trying to get stories, and I hadn't remembered this. But she said she had taken me out to eat with some family and friends, and I got a migraine at the table, and she had to take me home and leave everybody else there and pull over on the side of the road for me to vomit on the way home. I had totally forgotten that. So when I got back to the house, I had this huge rash across my face, going from one cheek across my nose to the other side. And when my dad asked me about that, I said, well, it'd been coming and going, but I thought teenager acne, so I hadn't said anything. I'd just been covering it, but it was really bright after I'd been throwing up. And he said, I think your skin is a window to what's going on inside your body, and I think we need to call a doctor right away. Now, I gotta admit, at the time, I laughed at him because he has something called dad science. I don't know if anyone else's dad has this, but my dad creates his own ideas and theories about things, and usually they're just kind of bizarre. And so it's just, all right, dad science, I'll see the doctor. But now I actually use that when I talk to my patients that, a healthy body has glowing, healthy skin. And when you've got something going on visibly on the outside, it is a sign. So he chalk went up to dad science on that one. But my doctor was actually really concerned, and she met me in the emergency room. And that's the day where I went from kind of a normal teenager with little weird things happening in there to fully just a sick person where, they were just taking blood every other day. I had like needle marks all over my arm, just in and out of the hospital. My blood test showed that my kidneys were in trouble, so they sent me in for a kidney biopsy. So next thing I know, I'm going into surgery. So it was just so chaotic. And the doctor told us what happened, and they said, you're in stage 4 kidney failure, and you've got 6 months if we don't do something really, really aggressive. 6 months you'll be in dialysis or you'll be dead. So, so my family's very much, I was raised by a family, they're immigrants, they're Holocaust survivors, and they came to this country, for opportunity, and also with a very firm belief that doctors know everything. I've never met a patient who thinks the same thing, but when I was a kid, I was raised that whatever your doctor says is what you do. And so my parents went along with, okay, you tell us what to do. So I was put on high-dose steroids. It was about 7 different pills I had to take every day. And I also was put on experimental chemotherapy to try to save my kidneys. And so the reason they were using chemotherapy is they had this idea, because chemotherapy normally is used for cancer patients. And the side effect of chemotherapy is it shuts down the immune system. So people who are on chemo often get really sick with all these other colds and other problems because their immune system doesn't work. Well, with lupus, your immune system's attacking your own body. And so my immune system had suddenly stopped recognizing my kidneys as my own and were attacking my kidneys, trying to kill it, as if they were invading. And so the thought was, if we can shut down the immune system with the chemotherapy, maybe we can put in a remission. I call it rebooting me. They rebooted it. They shut down my immune system and then just slowly let it restart again. And it worked. It was a miserable 2 years, because they had me on it from 16 to 18 years old. Every month it was increasing doses, and they really didn't know what to do back then. It was an experimental treatment. Nowadays they put people on it for a couple weeks max, maybe a month. But I took it for 2 years straight, so 16 to 18, my life was really about get the chemo. For a week I'd be just unable to eat because of all the vomiting. The second week I'd be afraid to eat because of the vomiting. By the third week, I'd finally start to be getting my energy back, and then the fourth week was time for another treatment already. And that was, I just kind of went through those 2 years like that, where I did my treatments, I took my meds, I went to school, I studied. Whenever I couldn't go to class, I would just read my textbooks. So, I was already a nerd to begin with. People thought I was teacher's pet at that point because I knew all the answers when the teacher would ask a question, but it was because I was reading ahead, because I didn't know what would happen and if I'd be able to, study when it was time to. So in spite of all that, I still graduated top 10 in my class and got into my dream college with scholarship. And I actually started my first day of college at Carnegie Mellon a week after my last chemotherapy treatment. I'd already not only gone through the kidney failure, but I'd also developed blood clots that had happened when I was in medical school. And so I was taking blood thinners because I'd experienced a mini stroke, a transient ischemic attack. And thankfully, I didn't damage my brain, but I was in a lot of danger of dying at that point if I didn't use this blood thinner for the rest of my life. So I was injecting myself every day. But, I really, at that point, I was so just grateful every time there was some treatment that could keep me going. It kind of just seemed like, hey, not my time yet. Like, there's just another thing. And I always joked around I was an overachiever, that, I was going to get really sick, but then there'd be a medication and I was going to keep going and I was going to get better. And so at that point, when I met my husband, I was on the blood thinners, but otherwise, I was trucking through. I was 2 months away from graduating medical school. And so this dream I had that the doctors told me and everybody else told me, don't go for being a doctor. You need to relax and get enough sleep and, not have too much stress. And I just wanted to have my life. I wasn't going to just sit around, I wasn't going to be disabled. I wasn't going to be the sick person. I wanted to do something. So I was doing it. So I was almost there. And I was really just at a highlight in my life. Like, I could see it. I'd gotten into this residency at UCLA Harbor in California. So everything was great, and I wasn't really needing anybody. And then I met this most amazing person, Thomas Tadlock, and he just changed everything for me. And I went from only dreaming about a white coat to dreaming about a white dress, And the hardest thing I ever had to do was to tell him about my illness and the fact that marrying me was not going to be long term. And it was hard for him to hear, but he just said that he'd rather have a short life with me than a lifetime with someone else. So he would take care of me. He would live with me and he'd take care of me as long as I had. So quite a man, because I was told I couldn't have kids. I was told I probably wouldn't live past my 50s. I'd probably be handicapped by my 30s, but he wanted to go for it. So if he was willing to go for it, then I was willing to go for it too. So at that point, it was really about just planning. So not only was I now getting ready for residency and finally got my MD and I was going to be a doctor and all the things I'd been hoping to do and I was going to be able to help all these people, I was going to get married. And so it was really, really exciting. It was like, the universe couldn't give me more. You know, I was so grateful for everything I had. So the next thing I did was I said, well, you know, at the time my husband was working for MTV, and he was helping recording artists get really fit for videos, you know, and I said, I want to look like one of them. And at first he thought it was a trap, like, no, sweetie, you look fine. You know, men get a little nervous, you know, and I said, no, I just want to look great. We're going to go to Maui, we're going to get married, and I want to look as good as I feel emotionally. And I want to do it in a healthy way. And that's what he did. It wasn't about starvation, it wasn't about hurting your body, it was about learning how to take care of your body. And so I wish I could say, people always ask me, how did I know that this was going to heal my lupus? And I did not. I wish I was that smart. I'd gone through 4 years of medical school, so I knew there was no way to actually get rid of lupus. All you can do is control it with medication and hope for the best. There was no treatment that was going to ever make it go away. So that wasn't my goal at all. It was purely vanity. I was like every other woman who was getting married who wanted to look great in their wedding dress. I just didn't want to starve myself like all my friends did. I have one friend who starved herself for her wedding day and gained 20 pounds on her honeymoon. Literally, like she weighed herself 20. I didn't want that. I wanted to take care of myself. I didn't want to be at risk for hurting myself further. So he created a program for me called the Dream Body Program, and it was 4 months of learning how to nourish my body in a way that would cause me to have a fast metabolism. And what a fast metabolism really is, and most people have no understanding of really what metabolism is a measurement of your cell's ability to change when you ask them to. Change in terms of losing fat, or gaining muscle, or changing your health. And so when you have a fast metabolism, you can get any kind of result you want. But the only way to get it is to give your cells the fuel they need. And most people think about fuel in terms of these big building blocks like protein and carbohydrates and fat, but that's not what it's about. It's about vitamins and minerals and phytonutrients and enzymes and things that your cells actually need. And so he developed a program for me where I had to eat so much food, more than I'd ever eaten before, and drink all this water and do all this, eat more than I ever had before. And he told me that was going to make me actually lose weight. So even though I was skeptical, I did it. And in the 4 months, not only did I go from a size 10 to a size 3, but I was really fit, and I'd felt the best I'd ever felt in my entire life. I had no more aches and pains. My joints felt great. I was energetic, even though I was an intern at this point who was working 30-hour shifts up all night in the emergency room, and I still had energy. In fact, my director pulled me aside, the residency director pulled me aside because he was concerned that I seemed way too peppy and upbeat for an intern. And most of them are morose and depressed. And and I showed up every day with a smile. And he said, I'm a little concerned that, you seem too happy. And I thought he meant this. I said, I don't know what I have to be sad about. I said, I have the job of my dreams. I get to help people every day. I've got an amazing man in my life. I live in a place where it's always sunny. What is there to be sad about? And he just kind of, okay. And my fellow interns also said that it annoyed them that I was too happy, but I didn't care. I just did my thing. So in spite of all of that, I had tremendous energy. And so when it was time to get my blood tests and everything, I didn't really think it was going to affect them because that wasn't possible. I just, I thought this was just something that improved how I felt. And so I told my husband, well, whatever this is that you did, I'm going to eat this way from now on because I feel so good. But I didn't expect it to affect my blood tests. And what happened was when I got my next round of blood tests a few months later, all the lupus indicators were negative. And really, if you're not from a medical background, it's important to understand that this is medically impossible. When you've had your blood test convert over to positive for lupus, there's something called an ANA, anti-nuclear antibody. It's an antibody against the DNA in your cells or the nucleus of your cells. Once that's positive, it's positive forever, we thought. Mine was negative. The antibodies against my DNA, which were in the 20,000s when I was diagnosed, higher than most people had ever seen, those were negative. Everything that would indicate that I had lupus was negative. And the blood clotting antibodies I had, those were only on the high side of normal, which normally wouldn't even treat except for the symptoms I'd had. And so it was funny because these were new doctors out in California that I'd never seen before. And the doctor had a medical student with him, and he said, "This woman alleges to have lupus, but we're not finding any evidence of it," as if I was trying to fake it. I want nothing to do with this disease. So, they said, okay, well, maybe there's just an error in the test. Go have your wedding, come back, and we'll test again. And we tested again a few months later, and now even the antibodies for the clots were completely negative. And my blood pressure was coming down to that of an athlete. And my genetically high cholesterol that I was told I could do nothing but blame my parents, that's what my doctor had told me as a kid, that was completely normal and in fact optimal. And that's what's happened ever since then. And right now I'm sitting here and it's been 10 years since that first negative blood test, and there's been no sign of lupus coming back, in spite of me continuing to go on and not only expose myself to those things they said I shouldn't, like going out in the sunshine, but also having 2 children. I have continued to actually get healthier and stronger as the years have gone by.